for Jackson County. First item on the agenda is approval of the agenda. The chair will entertain a motion. Thank you. There is motion and support. Any comment on the agenda? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. Now we are up to public comment. Public comment, a 3-minute limit, please. And according to county policy, please confine your comments at this particular public comment to those items that are on the agenda. Any public comment? Last call for public comment. Public comment is now closed. We move to committee items. First, on item 4A, are minutes of last month's meeting. The chair will entertain a motion.
So moved. Support.
Thank you, Commissioner Bear. Commissioner Snell, any comments with respect to last month's minutes? Hearing none, all those in favor will please say aye. Aye. Any opposed? Thank you. We now move to appointments. For the Department on Aging Advisory Council, there are 2 vacancies existing for terms expiring in December of 2026. We've had no applicants thus far. Are there any nominations from the floor? Hearing none, we'll continue to advertise those, and members, if you think of anyone who would be a good member on that, please let the chair know. Next item is Lifeways for a commissioner post that the term expires in March of 2029. The incumbent is Commissioner Snell, and he has applied to be reappointed. Are there any nominations from the floor? Hearing none, all those in favor of Commissioner Snell will please say aye. Aye. Any opposed? Thank you. That'll move forward to the full committee, full board next week. And now for an opening on the Veterans Affairs Board for a veteran whose term would expire in March of 2030. The current member is Bill Tripp. He has not reapplied. Are there any nominations from the floor? Hearing none, we will continue to advertise that, and I would also ask members to consider any veterans that might be interested in that post. One comes to mind, Commissioner Snell. You and I might talk about that.
Mr. Chairman,
Yes, sir.
just a point of reference, those are dedicated seats, and so if there is not an eligible person from the World War I or earlier conflicts, then you can appoint an at-large person. But if it's someone from a current event, they have to have participated, just so you're aware.
Okay, thank you, Mr. Chair. All I see for the criteria is that it's a veteran. Is it a more specific criteria than that?
Yes, there is, and I would reach out to the Veteran Affairs Director to find out where and when that, what seats are actually open.
Okay, thank you, Mr. Chair. Having concluded appointments, we now move to Lifeways, and Madam Director, Cassie is here.
All right, so in front of you, you have 2 items. We have a presentation on the millage. That comes to you annually, and then we also have the quarterly report, and we will start with the millage presentation. So good morning. My name is Cassie Watson. I'm officially presenting to you as the CEO of Lifeways following Mary Beth's retirement on February 2nd. I've presented here previously, but I want to preface by saying that this is the first time that I have presented on the millage report specifically. So if you have questions that I don't have the answer to readily, I will take those back and either communicate back to you via email, or I can come back to this committee at your pleasure. My goal is really rarely to say I think in reference to the data. So if there is something that is measured quantitatively, I'd rather give you the specifics and the actual information versus the I think it's about this. So the next slide, please. So the agenda for today is that we are going to go through the 2024 budget to actual. The reason for this is that the millage is run on a calendar year, but Lifeway's fiscal year runs from October 1 to September 30th. So you will see some, I'll call them inconsistencies here, but the financial information will be for a full calendar year of 2024, and then all of the service activities will be for our fiscal year 2025. So if you have any questions about that, please let me know. And then I will also give you our 2025 service plan for services. Next slide, please. And you can hit it one more time. So on the screen, you'll see actual budget revenues versus expenses from 2022 to 2024. You'll note that the revenues from the millage did increase in 2024. The only item I will identify here that is important for you to know is that some of these financial financial information is unaudited at this time. We are currently undergoing our audit for fiscal year 2025. So the details for October to December 2024 are unaudited. Our audit should conclude at the end of April, and we would be able to present more accurate information related to revenue and expenses. On the screen, you'll also note that in 2024, there was a significant increase in consumer services that is related to a significant increase in the number of individuals who have no insurance requesting services, so seeking services through our system. Next slide, please. 2025 service delivery. So as you know, or have probably heard, we have several contracted providers through which millage funding is received or granted. And one of those services is Family Services and Children's Aid, which they are appointed by the court to act on behalf of individuals. So they provide guardianship services to individuals who need guardians and who don't otherwise have a caregiver who can step into that role. They were able to provide 249 services to individuals in Jackson County as a result of the funding provided by the millage in 2025. Next slide, please. As you know, trauma-focused services is one of our priorities specifically for youth. We're particularly interested in supporting the youth in our communities, and Family Services and Children's Aid does provide both family services but also services to youth. They provide services through the millage in several schools. And what you note on the screen is the number of students that they served throughout the educational year. So that's why it doesn't represent a full year of information, because obviously schools are in session from September to June. So throughout their school year, from 2024 to 2025, they served 148 students during the first quarter, 204 during the second quarter, and 205 during the third quarter. And they also had a number of students, about 53%, who actually did not have insurance coverage or otherwise have access to trauma-focused services. Good. Yes.
Go ahead, Commissioner Bear.
Sorry, the number of students that you show here, is that just Jackson County students or multiple counties?
Yes, this is just Jackson County students. So the way that we separate the services is we look at the fund source. And so when we are separating these services, it is the millage in Jackson County's fund source. So this would only represent students in Jackson County.
Okay.
Welcome. The services, when we talk about trauma-focused services, what students are receiving is called trauma-focused cognitive behavioral therapy, and it is an evidence-based practice that is specific to children and adolescents impacted by trauma and their caregivers. So it is an evidence-based practice. You'll see the reference to TFCBT on the screen or on your report. That is what TFCBT means, is trauma-focused cognitive behavioral therapy. Next slide, please. I thought it was important to give you some context around the students that Family Services and Children's Aid are serving through use of the Jackson County millage. The average age of students served is 14 years old. The average number of traumatic events experienced by those children is 6, and that's in their lifetime. And then as a result of services, the impairment in daily functioning, which is measured by an evidence-based tool, the improvement is 60 points. So when students are coming in, they're coming in at a very high level of impairment in their daily functioning. And by the end of their services, that impairment in daily functioning has improved. So they're able to interact with their lives socially, educationally, in their community, and also in their family. So looking at the total number of sessions, 145 during the time frame of October 2024 to December 2024, 169 during January 2025 to March 2025, and 191 through June of 2025. Next slide, please. Another component of trauma-focused services is focusing on the parents. So Family Services and Children's Aid does provide parenting education. What that is a nurturing parenting curriculum, which is an evidence-based curriculum that really focuses on positive parenting and building stronger families, because we know that children's experience at home is just as essential as their experience in the schools and in their communities. On average, FSCA provided 12 groups per month and 4 individual sessions per month to participating caregivers. So this isn't necessarily only parents. This could be grandparents who are the guardians of a child, or it could be some other arrangement, a foster care situation. But usually these are it's curriculum tailored towards parents. Next slide, please. Community engagement is an essential component of the Jackson County Mental Health Millage. So ESSA Arts, which is a provider in Jackson County, does come to Lifeways pretty frequently and regularly to provide community engagement activities for individuals in the Jackson community. They offered 20 art lessons during the time frame, and a total of 241 students attended. So pretty good turnout, and this is another way for individuals to get access to community inclusion and immersion in the community. Next slide, please. Club Life is another provider that is contracted with through Lifeways for delivery of the mental health millage services. So Club Life is specifically tailored towards individuals, adults with intellectual and developmental disabilities. These are individuals who usually have aged out of the school system. And so they provide social enrichment programming in Jackson County. They provided a total of 2,784 services to individuals. So it says individuals up there. These individuals could go to multiple classes. So this is not a distinct count of individuals. This is just the total number of times that they accessed a service. And then you'll also see in the graph, I tried to lay out what kinds of programs they're participating in. Mostly it is social events, because it's very important for community engagement to be a focus for individuals who have aged out of the school system, because they no longer have access to that really structured community engagement and programming. But they also had opportunities to go to travel events and fitness events. For example, the use of this millage provided access to allowing for these individuals to go to a Pistons game. Didn't pay for the tickets to the Pistons game, but it allowed for the supports and resources that they needed to get to a game, to safely interact, and then to safely get home. So use of this millage can allow for expanded social enrichment activities that are not a parent or caregiver who is providing it. It is service staff alongside other individuals experiencing similar behavioral health challenges, and also friendships, right? These are friends that get to come together and do things that the general community community members can do. Next slide, please. Crisis intervention training is a curriculum that Lifeways actually puts on. We have trainers that are employed with Lifeways who provide this curriculum. It's very well attended in Jackson County. We're very, very proud of the partnerships that we've developed across the city, township, county, law enforcement entities. Lifeways did train 12 officers during the fiscal year 2024. I think that'll be higher for the coming years with just how we're continuing to ramp up that program. And while it's not provided through the millage dollars, I think it's important to identify that we now have an embedded clinician in the Jackson City Police Department. And that's a testament to, again, this community rallying around law enforcement mental health partnerships. And that was truly a result of the millage funding that has allowed that continued partnership to grow. Next slide, please. Crisis services, we had a total of 1,400 crisis services provided outside of our typical business hours of 7 to 7. This is about 118 services per month during the non-business hour times. And this is also specifically for individuals who are uninsured, who are accessing services through use of the millage dollars. Next slide, please. Jail mental health services. This is a very exciting partnership and opportunity with our jails, again, highlighting the partnership that we have across the continuum of justice, the justice system in our community. So Lifeways has one clinician in each county jail. So we have two at Channer Street between the supervisor and the clinician. We have one at Wesley Street facility. They all provide services, but they look a little different in each jail. The reason for that is the populations in each jail are a little bit different. So in Wesley Street, we mostly offer crisis services one-on-one and assessments. And then in Channer Street, what we can do is offer more group services, individual therapy services, crisis services. But in Channer Street, a lot of times what you'll see is we're actually working on transition, whether that is transition from jail to prison, or from jail to community. We're working a lot on how do we help someone navigate the next system that they're going to be part of, and how do we, especially if it's a community integration, how do we help them make sure that they have the services and supports that they need in place so that they don't come back through the door. What we don't have a good demonstration of yet, because we continue to need to talk about it, is what is the recidivism rate? And we don't have that because the systems that we work within, the data that we get doesn't align. We're not in the same system. We're not saying, well, this person did participate with Lifeway services and now they're back in jail, or they're out in the community and they've stayed in the community for X number of years. So I think that's an opportunity for us to look at for the next year, is how do we really demonstrate the outcomes. But what we can say is that we are very fully embedded and participating alongside law enforcement and hopefully trying to get folks to stay in the community after they've had an experience with law enforcement or through being in jail. So 714 distinct individuals received services and 9,000 total services were provided. And again, that's because of the groups, because each service is considered one for each individual that participates in a group. Next slide, please. So total millage services, as I alluded to in the first slide on the budget to actual, we did see an increase in the number of individuals accessing services through the use of the millage dollars because we had an increase of individuals who don't have insurance. We probably will see that trend continue. That is likely if Medicaid cuts occur and or if individuals are not supported in doing their re-enrollment process, because that will be a little bit heightened scrutiny on and timeframes on their re-enrollment. So if someone doesn't re-enroll for Medicaid as indicated or supply the evidence for their eligibility for Medicaid as frequently as they need to, they would fall into that uninsured category. So may see this trend continue, but we're still kind of waiting to see what the president's budget looks like. We're starting to wait to see what the state does too. The governor has released her budget, but we don't really know what the state of Michigan will do from a Medicaid perspective until the budgeting process has completed. Next slide, please. So the millage budget for 2025, fiscal year 2026, you can go to the next slide. So again, looking at a carry forward of $1.15 million, a revenue of $1.84 million, with continued focus on the uninsured and underinsured mental health services. And then I will just note that we are working with the Interface Shelter, Jackson Interface Shelter. So they have hired a therapist who will work on site. And so that $50,000 allocation there is specific to the services that they'll provide on site to individuals who are residing in an Interface Shelter. All right. Any questions on that?
I'm sorry, John, I'll get John and then I'll get Corey.
Thank you, Mr. Chair. On the homeless, if there are other homeless or agencies, do they have access to those same services, or does it have to be through Interfaith?
So if, right now the contract is with Interfaith, so if there are other entities that would be interested in providing a similar service, then that would be something to have them reach out to Lifeways, to the contracts department, which should be on our website, but otherwise I can follow up with the specific contact information to explore the millage dollars that are available for future services.
Thank you. That's all, Mr.
And Commissioner Kennedy, please.
Thank you, Mr. Chair. Going back to really the beginning of your presentation, the budget, I didn't want to stop you in the middle of it.
That's okay.
I just want to try to understand it and see if my rationale is why that's occurring. But I noticed it's a pretty substantial increase in the salary fringe. And then but I see those 2 years prior, the 22 and 23, you had a surplus. So is that in an attempt to spend down some of the surplus? Is that what you're doing there of the millage dollars, or the reserves, I should say?
So part of it is the jail clinicians, actually. The reason that there's an increase is that we did not have those positions filled for an extended period of time, though they were posted. So some of the salary comes from that. And then there is also community health workers who moved over from a grant to this position, but that should also decrease because we're able to bill for their services now. So some of it is drawing down on the revenue or the carry forward, that reserve, but most of it is related to actually getting some positions filled, and then we're starting to bill for some positions that were allocated to the millage.
Okay, then my only follow-up question to that would be is showing the 832,000 and some change deficit for fiscal year 24.
Yep, drawing down from the
Drawing,
reserves.
so you're comfortable with your amount of reserves that going forward, that deficit each year isn't gonna put us in any trouble?
Correct, yes. The finance department is, and the board is comfortable with that, although we are still looking at, we have CCBHC funding, which is a local funding, and so balancing what should be CCBHC and what should be millage. Yes, they're comfortable, but that's a continuing conversation.
Okay, thank you.
I would add, that's not a sustainable
Correct.
rate of decrease, okay? So management is aware of that also.
Correct.
Somehow we've got to make sure we don't burn through it and in a way that can't continue the services as we would expect them to be in the following year.
Correct, yes, and that would be the balance between CCBHC and millage, is setting a cap on how much millage reserve we are actually using.
Okay, Chair will entertain a motion to receive the annual report of Lifeways. Thank you. Any further questions on that? All in favor will please say aye. Aye. And then you have another report, Cassie, and I would ask you to speed through that.
Yes, absolutely. I just have one comment on this report. If you have any questions, I can certainly follow up on those. Just the comment that I have is on page 3 about the MDHHS PIHP procurement. PIHP is the Prepaid Inpatient Health Plan. That is the entity that we hold our Medicaid contract with. There was a lawsuit that indicated that the department's intent to consolidate PIHPs into 3 regions from 10, and then also take away some of the managed care functions of like places like Lifeway, CMHSPs, was unlawful. Judge Yates did confirm that yes, the RFP as written did violate Michigan law, and so the department has since rescinded that RFP, and there has been some ongoing collaboration with the department, but we don't know what the intent is, because we believe that the intent is still to consolidate or change the system, but certainly in a different way. So we're continuing to collaborate with MDHHS, and that is the highlight.
Okay. Questions on that part of the report? Chair will entertain a motion to receive the report. Thank you. All in favor will please say aye. Aye. Any opposed? Thank you. Thank you, Cassie, for being here. Let's see. And next, DHHS's quarterly report. Good to see you, Jackie.
Good to see you all. Good afternoon. Happy sunny day. I call it fake spring because that's where we're at. It'll be snowing soon. Thank you for the opportunity to present to you today. I have kind of a brief update this time. What the most significant update I wanted to share is a model that the child welfare side of DHHS is moving to. It's called the teaming model. Just in a nutshell, the way that our children's services exists in today as we sit here is pretty siloed work areas. And when I say that, I mean there's Children's Protective Services investigators, staff that do Children's Protective Services with ongoing cases, and those are the cases where we have found there to be risk of abuse or neglect. And then there's a staff dedicated to foster care case management. So I say siloed. Definitely, we always work together as a team, but the workflow is individualized. The teaming model melds these roles a bit. This is the largest overhaul of child welfare that I've seen in my 25 years, so quite a big undertaking. We're currently in wave 2 of this rollout, and Jackson is in wave 2, which is why I'm bringing it to you today. Really, the goal is to reduce the number of handoffs that a family has to experience within the system, the number of worker changes, the number of department and like goal changes throughout the trajectory of the child welfare system. So there'll still be Children's Protective Services investigators, but the melding of roles comes with the Children's Protective Services ongoing staff are also going to be foster care workers, and the foster care specialist workers are going to also be CPS ongoing staff. So those are if a family is working with Children's Protective Services on a case that has been substantiated and we're working to bring that risk level home or bring that risk level down, in the event that a removal needs to occur, that worker keeps that case. So there's less handoffs, more continuity and consistency for the family, less confusion, less rapport building, less need to reestablish what has happened and start over again. That's one of the enhancements. The exciting one of the exciting parts of this is 2 additions to our team that we have not yet experienced, which is a family teaming specialist, which is like a social support assistant is what the old name of that was. And those folks can help with parenting time, observations, transports to medical appointments, dental appointments, really all of the extra things that keep workers tied up in places that kind of prevent them from doing more engagement with their families. It's all of the task-related items, kind of externally that have to happen in a case. We're going to have a specialist designed to take up some of those things. The other part of this is a family resource specialist, and those are the staff that work on the assistance payment side. So staff that determine eligibility for Medicaid, food assistance, cash assistance, the economic stability side of DHS House. There will be a specialist assigned with the Children's Services team to go into the homes with us, with the Children's Services staff, so that we can stabilize families very quickly. And so we can get the crisis that is affecting them economically taken care of, so that we also can focus on bringing the risk level down of abuse and neglect. So it's that team approach that is so exciting and very much needed. We've already had a couple run-throughs, even though we're not full up teaming yet, of when the FRS, the economic stability staff, went with us on home visits, and within an hour's return from that home visit, I had both sets of staff emailing about how productive and positive that visit went, and the crisis that the family was experiencing in the moment on the economic side was taken care of within like an hour and a half's time, which normally, as we're siloed, there's lots of back and forth between the workers trying to get things taken care of. So it's just an exciting development. I'll keep you posted, but I wanted to let you know that there's pretty significant overhaul of the child welfare side happening right now, and hopefully producing better outcomes, and I feel that it will. Our county child care fund, we're doing well there. We've lapsed more of the fiscal year than we've spent, so I always keep you posted on that, but we're looking good. Still working on finishing out on the assistance payment side, our state of emergency relief requests. Those are the highest when we're in the cold seasons, so we're still finishing out those, and those will come down over the next couple months. But still kind of at a high volume for those. April is Child Abuse Prevention Month. I'm gonna leave a couple of these flyers on the back table for anybody who wants to join us on April 9th at Austin Blair Park. And that's from noon to 1. It's just planting of pinwheels, which is significant for Child Abuse Prevention Month. We'll be planting those in the garden there in front of the Council for the Prevention of Child Abuse and Neglect. We partner with them every year to do that. And we'll celebrate. We'll celebrate Child Abuse Prevention Month and all of the good work that goes into that and assistance with our families in this way. And then I've just attached a list of meetings, both community and DHHS. So if there are any questions on that, I'd be happy to answer those. And that's it for me today.
Questions for Director Carafino? I will ask you, Jackie, if you would still please bear in mind Lifeway's interactions with DHHS. Apparently, the lawsuit that occurred with respect to this bidding process
Yes.
by virtue of the PIHPs apparently has settled things down because DHHS has kind of backed away from it.
Sure.
But as whatever the next idea DHHS has, we would ask you to be hopefully engaged with your management
Sure.
to make sure it works for not only DHHS, but also for our mental health, community mental health providers, okay?
Yes, absolutely.
So thank you for
Sure.
being our ear with your directors there in
Yeah.
Lansing.
Yeah, and Miss Cassie, Miss Watson, we've connected already several times. We collaborate pretty well on the children's side, as well as we've just had a joint Medicaid spend down call, even with our state partners, and have brought the whole team in. So we work really well together locally here. And so anything that the local office can assist with or have any control over, we will definitely partner well, so.
Well, you have a chance to bend the ear of your superiors
Yes,
in private, I'm
absolutely.
sure. But if
Absolutely.
you bear in mind that
Sure.
what they pitched earlier was very problematic, and no one understood why. So
Yeah.
thank you for
You're
bearing that
welcome.
in mind. Thank
You're
you.
welcome.
Chair will entertain a motion to receive the report. Thank you. Thank you. We have motion and support. All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
And to next. Must be the medical care facility. I see Madam Director coming up. I'm sorry, I'm gonna completely continue to complain about this system, Mike. You'll get good at it. I doubt it. Okay. Thank you for being here, Destiny.
No problem. Okay, so to jump right into the report, if you could go to the next slide, we're going to start with quality. And this is the CMS 5-star ratings for our market area. So as you can see, we are amongst the top rated. Still, that has been pretty consistent with our 5-star rating. If you go to the next slide for me, we continue to have 5 stars overall. 4 stars in our survey rating, 5 stars in quality, which that was a move last month from 4 to 5 stars in quality and 5 stars in staffing. We're one of 2 homes in our market area with 5 stars overall and one of 2 homes with 5 stars in staffing. I will tell you that those quality metrics and the staffing makes a big difference with referrals from the hospital. It has allowed us to be positioned as a preferred provider within their post-acute network with the hospital, allowing us to continue to have a very strong stream of referrals coming for short-term rehab. Again, we continue to be the 5th lowest in overall nursing turnover in our market, lowest in our market and 5th lowest in the state, and then the 8th lowest RN turnover in the state at 2.7%, which I think I mentioned last month as well. The 7 people above us all have 0 turnover for RNs, which makes me question a little bit of how many RNs are available to them for that little bit of turnover, but we're very excited about that metric. So moving on forward, we're going to get into finance here for January. So for revenue, our revenue was behind budget by $109,895. That was expected coming out of December. We did see quite a dip at the end of December as we seen people going home for the holidays, less hospital admissions. So January was really about trying to rebuild, and we've had some rebuild that has had to flow into February as well. Expenses were under budget by $67,429, giving us a net position of $42,466 less than budget. However, we still had a positive margin for the month of $33,789. Census was budgeted at 183. We had a budget or an actual census of 181. We had 48 admissions and 38 discharges. So it's always good to see those numbers where the discharge number does not match admissions. But that's part of the ebb and flow that we experience. If you move to the next slide here, you can see our census trend line so far for this year. And since this was created, we are now today sitting at 187, which is well above the budgeted census. So we're working in the right direction, but as you can see, some of that fluctuation did go into February. And with February being a shorter month, we anticipate that those financials will be not at budget. Okay, moving forward to the next slide. Just wanted to review our accounts receivable days outstanding is below our goal of 54 days at 52 days. Cash on hand is estimated at 24 days based on January's actuals. The approved budget projects a range of 18 to 25 days cash on hand throughout most of 2026. So I wanted to share that out with you a little bit more. I know there's been a lot of concern about the cash on hand number. The lowest that we anticipate is dropping down to 11.7 days, and that would be at the time that the cost report settlement is received, invoice is received, if we were to pay that all in one lump sum. So even with paying that, we would still have cash on hand, though quite a low amount. I do want to note the 24 days cash on hand is steady with December's cash on hand number, so we didn't see a drop in that cash on hand from December to January. And that number is fairly consistent with what we were seeing pre-pandemic. So we've gotten very accustomed to seeing a higher rate of cash on hand through the pandemic years because of all of the different influxes of revenue and grant programs. However, if we go back and we look at 2017, 2018, 2019, being in this range is much more typical of what we've seen pre-pandemic. So just want to offer that as a kind of a level set of history because we have been so fortunate to have such a nice cash reserve over the last few years. This does not include any funds currently invested or in MOE funds, which is approximately $4.6 million in additional reserves. There are 2 planned cash obligations that can create some temporary pressure points for us this year. And that's our annual bond interest payment annual bond principal payment of $790,000 that's due in May, and the repayment of the Medicaid cost report of $1.17 million assumed to be in October. Both are budgeted. Both are projected out with those projected cash on hand numbers that I shared with you earlier. As of right now, our MOE/millage fund usage for 2026 is currently projected at $57,000 for our annual interest payment that's due in November. That's our typical request. However, there is some conversation that there may be the need to request some additional millage funding around of these pressure points, whether it be the principal payment or the Medicaid cost report payment. So hopefully I'll have more information on that when I come to you next month. And then the last thing I just wanted to mention for this report is there is a lot of conversation around the state budget right now and the impact of the One Big Beautiful Bill Act and how it's going to impact long-term care. So when that was passed in Washington, it explicitly excluded long-term care from any cuts. But as states, this is rolling out to the states are trying to figure out how to make up for the budget deficits that are coming from the cuts from that bill in other areas. So some states are looking at making cuts in long-term care. There is some debate going on here in Michigan about that. So I just want to bring that to your attention and ask for your advocacy around that we maintain the original intent coming out of Washington that long-term care is not impacted by these cuts. With that, does anybody have any questions I can answer?
Questions for the medical care facility? Okay. Chair will entertain a motion to receive the report. Thank you. There are motion support. All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you very much.
Thank you, Madam Director. Appreciate it. And now on to the medical examiner's report.
Hello.
Hello.
I'm going to keep it short and sweet for us today. I have submitted many reports. We have been quite busy. Usually our busiest year for medical examiner services is October through February. So we are now at the point where we hope we're reaching a lull in our case numbers. Basically, not all we've been doing, but we've been trying to keep up with casework, basically. In 2025, we had 650 cases just for Jackson County that were investigated. That is our second highest year since COVID. Our highest year was, I think, 2021 with 700 cases. We did 195 autopsies just for Jackson County in 2025 as well. We housed 368 bodies. 220 of those were for Jackson County at the morgue. So we have been quite busy, as I mentioned. 2026 so far, just January and February, we've had 117 cases and 40 autopsies already. I wanted to mention a couple fun things. We do try to take part in the community when we can. Obviously, we have a lot of students that are interested in science and medicine that do want to either come and see us, come talk with us, have some type of experience with us. We do try to help where we can. Obviously, we don't make donuts at our jobs, so we are very careful on who we include. So we have had over like fall, winter, several resident doctors from Henry Ford Jackson Hospital that had spent a month of their residency rotation with us. And basically they come into the office, they come to autopsies, that type of thing. We have recently had an Adrian College student at our office, and many students that want to go into a master's program to become a pathology assistant or an autopsy tech. There's a program at Wayne State University, and they require that they see an autopsy. So we do try to help students out. This Adrian College student was trying to get into that program, so we had her at our office for a couple days. And I also did have a Chelsea High School student at our office for a tour. We do not allow anybody who would be considered a minor to view an autopsy. We usually reserve that for graduate students or a student that's already in their junior and senior college year. But I do allow for high school students to come and tour the morgue. Usually they're students that are into anatomy, biology, they want to be medical examiners when they grow up, or investigators, that type of thing. And she was a really fun student to have in. I have a guardian come with them. In this case, it was her mother. So that was really nice, and I just thought I'd bring it. This is a thank you note that she sent us, and she made it. It's really cute, and she drew a dragon in here. If you can see, I don't know if you can see, and she put a mask on the dragon. So the dragon is wearing his PPE. So I just thought that was cute. And we also have done recently a couple career fairs. The last one that we did a couple months ago was at Clinton Middle School and in Clinton. And they always send us little notes that the student leaves about our presentations. And, you know, they leave fun little comments like, I like the medical examiner the best. But this one was my favorite one. It says, career day did not change my mind, but it did give me another backup option if I don't make the NBA. So I thought that was cute. But that's all I have for you today, unless you have questions, obviously.
Questions for the medical examiner's office? Not only have you been gracious with your students, you were gracious to give me a tour recently, and thank you for doing that. It's worthwhile to members to see our facility and the other stuff that's in our the same building there.
Yes.
Which is a lot of the SWAT teams kind of equipment.
Yes.
But there's plans, I think, eventually for those to move elsewhere. So it would be worthwhile for
Yeah, we'd
members
love-
to take a tour if
We'd love
it
that.
can be coordinated.
Yes.
So, okay. Chair will entertain a motion to receive the report. Thank you. We have a motion and support. All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Thank you. Keep up the fun things at the medical examiner's office. And I think we have the Department on Aging next. Is that right? Indeed, we do. Madam Director Danielle.
Well, good afternoon, everybody. Just to really kind of highlight, our Soups On event is tomorrow, so we're pretty excited about that. People are still purchasing tickets. We expect over 250 people to attend this event. I have attached a flyer so you can kind of see all the things that we have going on with the different restaurants and all of the sponsors. Some things that we're really excited about is just the amount of support from our business community for all the items that they've been donating towards the silent auction as well as our live auction. We've also, as people have been purchasing tickets, they've been very generous on top of that by donating items to the auction as well. So some people have been coming for several years, and so it's nice that they want to not just support by purchasing tickets, but they're also putting items into that auction. So we'll probably have over about, I think we're at 97 items right now, but we still keep getting calls where people want to donate things. So we're just kind of capturing all of that. So it'll be definitely a fun night. If you haven't purchased your tickets yet, feel free to do so. A couple of the things that are in the live auction, of course, are the Tower Tour certificates. And then we have a package that was put together from AARP and Brothers Landscaping, which is a pellet smoker type grill. Includes a package of a gift certificate for meat from Rives Quality Market. So it's going to be a pretty exciting item to bid on. One North is doing a dining experience for 4 people, so it's kind of like a chef's choice for menu items, but that'll be in the live auction. And then we also have a trike. A trike was donated, an electric trike, so that'll be available as well. So a lot of community support. Mark Daly from the radio even reached out and wanted to join us and be our MC for the event. So he's donating his time and giving back to the community in that fashion. So we'll enjoy his engagement with the audience that attends the event. So right now we're probably at about 19,000 that has been raised prior to anything coming through with the auction. So pretty exciting. So I think the little culmination on that report is a picture of the Friends from last year, and with their donation that they made last year just on their Soups On events that they've been doing, which this year is their 11th year, they have raised over $236,000. So that's pretty amazing. All going right back to Meals on Wheels. So they do all the expenses and cover that on top. So just to recognize them. I also wanted to highlight there is a survey that if board members would like to complete, it's with Wellwise Services. And this goes towards thinking about how the grants and services in the Jackson County and the Tri-Region, as Wellwise puts out their grant award, things that they'll be focusing on. This is something that aligns with the state's plan, is to get input from the community. There will be another opportunity beyond the survey to attend a focus group. So when I know those are happening, I will also share that information with the board. But if you want to take a few minutes and complete that survey, there's about 60 questions to do that. There's a QR code attached on that survey, or on that flyer, that you can go ahead and review. Or we've been sending out paper copies as well to our home delivered meal clients, and also to our senior sites, so that we get some input directly from the participants who are using our services. And I just also wanted to highlight at the bottom was some senior comments. We're working on our survey processes from last year, and these were just some comments that are coming through on our enrichment side, through our activity program, our painting programs, things like that. And one of the respondents said, "I love being able to attend regular and make/keep friends. We all need to stay active as possible." So again, thinking about all that we do for the community, not just on home service side, but again, helping to engage our older adults and caregivers and keeping them active.
Questions for the Department on Aging? Hearing none. Looking forward to seeing you tomorrow night.
Thank you.
I'll be there. Candy and I will be there.
Yeah.
The chair will entertain a motion to receive the report. Thank you. We have motion and support. All in favor will please say aye. Aye. Any opposed? Thank you.
All right, thank you.
Thank you, Danielle. And now, the Health Department.
Good afternoon. I actually have two items. The first on the agenda is my monthly report. It is, as per usual, pretty standard, couple things just to think about, or to, acknowledge, to bring to your attention, not for you to acknowledge. Our monthly report, obviously shows, all of the work that's going on or has gone on during the last month. But when we start looking at our community health education and promotion area, we are always working in the present, but planning for the future. So right now we're hiring for our Get Real Summer program. All the planning and everything is going on into that. We have 10 to 12 positions that are posted for that Get Real Summer program. We've already hired, it's mentioned back in the environmental health section, but we've already done our interviews and are set with our vector mosquito-borne illness intern for the summer. So, just a lot of planning ahead, as well as the work that's currently going on. Couple things to note in personal preventative health. March is National Nutrition Month, so we pull from the experience and expertise of our registered dietitian and nutritionist in our WIC program to, really push that information about healthy nutrition into the community. Bigger than WIC, because, we're the health department and looking to promote, public health all around. So using their experience to really get the word out, not only to our WIC clients, but also to, the community about the importance of healthy nutrition. In environmental health, we have 2 open positions that we are currently under interview for sanitarians in the health department. And we're also going into our busy season for both our field side and our food side. Field, as the weather breaks, as a day like today comes, digging starts in the ground. So our well and septic sanitarians are out there doing their work. And then right about now, in the next week or so, we will send out our restaurant license renewals. So if you remember, I was here a couple months ago talking about changing our fee schedule to go with the risk-based fee schedule, those new license renewals for the upcoming year, which begins on May 1st. We'll start going out and we'll start getting really busy with that, as well as like the temporary food trucks, temporary food operations, and then the transitory food units, food trucks. All of those festivities begin as this weather breaks. So that's pretty summary. There's a lot more information in there, obviously. If there's any questions, I can take those.
Questions for the Health Department? Hearing none, Chair will entertain a motion to receive this report. Thank you. All in favor will please say aye. Aye. Any opposed? Thank you. And then you had one more thing, I think?
Yes, I have one more thing. The next item I have is a request to approve changing what is 1.48 full-time equivalent position to a 1.0 full-time position with benefits. The state, for our WIC breastfeeding peer program, we have a separate grant that funds that position, and they have funded it at a 1.48 part-time position, where they said we needed 1.48 hours worth of work done in the breastfeeding peer position. Over the last few years, we've done this a couple different ways. At points in time, we've had 3 under 20-hour positions. Most recently, we've been in a pattern of having 2 people who work about 20, I guess it'd be about 24 to 26 hours per week, I believe, that meets that 1.4. We've had turnover, and we continue to have turnover in that position. So we recently approached the state to see if we could turn that into a 1.0 full-time position, benefited position, 40 hours per week. There's some rationale, we actually lose hours, overall hours of program hours that are worked by multiple people, but the benefit to that is hopefully some program stability, where the several times that people have left, I think 2 out of the 4 times last positions that have left, their reason being that they need more hours and full-time benefits. The second is it provides, these are, when you look at the rationale in the service level impact, I think that's the biggest point, that the breastfeeding peer position is relationship driven. It is about moms who need support in breastfeeding. The requirements for that position is it has to have been a mom who was on WIC and has breastfed. So it's really that, and then the title in and of itself is peer, that they are that person that mom, that new mom can reach out to. And breastfeeding can be a difficult thing. There's challenges associated with that. And obviously there's like lactation consultants and things like that are available through some insurances and things through the hospital. But then outside of that, once you've done that, we're really meant to be that peer. We offer a phone line where they can communicate primarily via text, where it's just a quick question on something's going on, and providing that relationship where a mom actually builds a relationship with one staff and isn't transferred back and forth between multiple, depending on what day of the week they need assistance. The cost to that program, there's a cost analysis in there. The cost to go from what we currently have at the 1.48 with two part-time positions is an increase of under $3,000, and that's if the person takes our full insurance. It'll be less if the person doesn't. It's also more because the current person that's in that position is already at a step 2 or a 3 in the pay scale. So it's calculating that with the person who would move into that 1.0 position. So not asking for any general fund from that. It will be fully supported by our grant and our local funds that we already receive from the county. So no additional funding will be requested for that. We also hope that some of that cost, that small $3,000, will be just absorbed and not having to, hiring is expensive, especially nowadays. Just posting on Indeed for 2 weeks cost me like $500 or $600 for our sanitarian position. So, when you decrease those hiring expenses, we'll save that just in the long run, hopefully.
The attachment is an Excel spreadsheet that kind of lapses over into new pages, just so, in ours, it doesn't, it's not on a nice, landscape legal, but as I understand it, the new position would cost $71,208. And the current cost, if I read it correctly, is $68,584 for the
Correct.
existing people. So that's where the incremental cost, higher cost of $2,624 comes from.
Yes.
Is everybody able to see that? It's probably hard to see in the attachment.
Yeah, I'll be sure the next time to print it in a PDF before I attach it to
There you go. Okay.
the quirks of the new system we're learning.
That's okay. Excel sometimes is that way. Any, Commissioner Bear has a question.
Thank you. You provided one page here that has a comparison between the current part-time breastfeeding peer counselor one and the proposed full-time. Whether it's the part-time description or the full-time description, they're both 20.57 hours per week.
That's the 20.57 is the hourly rate of pay. So that person that is currently employed by us who does, would take a full-time position, she is currently at a pay rate of 20.57. So on that second page that Commissioner Pileski was mentioning, a starting rate for that position is 19.36 an hour. So it's at the top, unfortunately, the way it printed out there onto your PDF. But currently, the top is what we have. We have two positions, one at 20.57 and one at 19.36 per hour. Going to, the current person will stay at 20.57 at 40 hours per week.
Okay. And you're proposing a full-time position. So this person will spend 40 hours a week on this task?
Yeah, currently, it's actually less hours per week than we are funded, than the state actually. That's why we had to get permission from the state. The state actually funds us for 1.4, so 1.5 positions, 1.5, so 3,000, over 3,000, I'm sorry, that's my phone, 3,000 hours
Okay.
for that position.
When my children were born, the hospital provided my wife with breastfeeding information, breastfeeding coaching. And so when she came home with our child, she was all prepared and good at breastfeeding. Are hospitals not offering that service anymore?
They do, and you often leave the hospital, but there's still a lot of challenges. I mean, my own daughter-in-law was not able to breastfeed. She ended up pumping and didn't have the support for that. So they do offer that. They do offer lactation consultants, but this is really more that peer that has been through those things. And sometimes it's just a question of, am I doing this right? How do I know she's getting enough nutrition? We obviously in WIC are already doing those things and doing weight checks and things like that throughout the course of their participation in the program. But, there's 4,700 kids on WIC at any given point in time, just in Jackson County. So whatever percentage of those are newborns, there's challenges among them for various reasons.
Okay, thank you for that explanation. Appreciate it.
Chair will entertain a motion to recommend the change to the full board for approval. Thank you. Thank you. Commissioner Wills supports. Any further comments? All in favor will please say aye. Aye. Any opposed? Thank you.
Thank you.
Okay. We now move on to other business, the claims. Chair will entertain a motion to pay the claims. Thank you. I have a motion to support. All in favor will please say aye. Aye. Any opposed? Thank you. And then as to other minutes, I don't see anything on the agenda for other minutes at the moment. we're up to the second public comment, and this can be on any topic that strikes your fancy for as many as 3 minutes. Is there any public comment? No public comment. Last call. Last call. Public comment is now closed. Committee member comments. Are there committee member comments? Hearing none, we stand adjourned at the call of the chair.